My name is Kenicia Curry. I'm a pharmacy program specialist, and I serve at various legacy sites depending on patient need. There's definitely a lot of experience I've had. I like to call it the light bulb moment that patients have. It's when basically you're meeting with the patient's had diabetes for 30 years, and I explain something as simple as this is how this medication works, or this is what goal we're aiming for, or this is why we're changing your medications. And you can see it in the patient's face where they're like, wow, no one has ever explained this to me before, or they finally understand why physicians or why pharmacists are recommending certain things. And so that light bulb moment for me really is why I became a pharmacist in the first place. And I'm grateful and blessed to be able to see that moment on our patients' faces. I would say what interested me most was firstly the patient population. I have a passion for serving underserved patients. And additionally, my bachelor's degree, in addition to my pharmacy degree, is actually in Spanish. So I have a love of serving the Spanish-speaking population. So here at Legacy, I get both of those things. I'm able to help the underserved patient population while also using my Spanish background. And we have a staff that is mostly Spanish-speaking. So this is a unique experience that I haven't had the opportunity to have before. But also what attracted me to Legacy was the value that the pharmacy puts on our pharmacists specifically. We're all clinically trained, we all have clinical rotations, but often we're limited to the dispensing role as pharmacists. But at Legacy, there's a value in what we do, and they push us to operate at the top of our license. So we offer clinical services at our pharmacies, hepatitis C, supporting HIV patients, just many patient populations that we otherwise would not be able to serve. And so that's what attracted me here. There's actually a nationwide physician shortage, and because of that, it's taking time for patients to sometimes get in to see their primary care providers, or if they need quick follow-up, we just don't have the capacity in places outside of Legacy. So in all facets of adult medicine, in our other like pediatrics, in our other services that we offer here, pharmacists are now able to bridge that gap in between appointments with physicians. So in this setting, we're considered ambulatory care pharmacists, which basically means that in place of seeing your doctor, you see a pharmacist. We're able to manage patient medications. We're able to prescribe medications under the supervision of a provider, and we're able to really collaborate with our providers to address any care gaps and help our patients reach their healthcare goal. And so Legacy continues to expand outside of our traditional patient population that is at the Montrose Clinic, but now moving into geriatric care and utilizing our pharmacists and our clinical skills to be able to meet that care gap. I'm really excited to be working with our seniors in our community and collaborating with their providers to help them meet their immediate needs, to help provide medication education and access to medications, but specifically for our older population. I would say I want patients to know that they are their best advocate. We always tell patients what they should do and how they should treat themselves and what medications they should take, but patients should be involved in their care. And I think it's important for people to know that when you come into your pharmacy, we are basically the most accessible healthcare providers because you can just walk in and talk to a pharmacist. If there is a medication that you're taking and you're wondering, why am I taking this? Do I need this medication? Ask, always advocate for yourself, because there may be a way to adjust your regimen that is best for you. As pharmacists, we give patients the tools to treat themselves, but getting better or improving your health is completely in your hands, and I think that's important for patients to know.